a lot of my patients, when they come to see me for the first time, they've already seen a few other people, doctors, that they were hoping would help them. Normally, you go to your family doctor first, if you still have one. And depending on what your symptoms are, you may get medication or a referral. And then more often than not, you'll get a referral to a specialist that may or may not take months or a year in some cases. And or so when you do see your specialist, what do they tell you? Probably stuff you already heard. And they may do some more advanced stuff or medications that are new to you. But over time, I mean, the hope is that you do feel better. But if you don't, you end up coming to see one of us. And that's okay. That's sort of a common path that leads to the naturopath side. And, we try to work with those guys wherever they let us, however they're willing. But however you get to us, that's okay. And I think we end up doing a lot of damage control. And by damage control, I mean recorrecting or retraining a lot of stuff that you maybe thought or you felt like you understood even just on your own with your own education or research. Because a lot of the stuff that I end up telling patients, it's like they've either heard it for the first time or it's the opposite of what they know. So I think that's maybe one of the obstacles to feeling better is to overcome bias in your understanding of health or what your condition actually is. Because if you feel like you understand what's going on and keep doing certain things and maybe I'll tell you that it's making it worse, then all along you've been sabotaging yourself without realizing it, even though you had good intentions. And the doctors that you've been seeing, that's their training, that's what they think is the right thing to tell you. I guess it helps if I give an example. That's going to bother me. Like eczema. I like using eczema as an example because a lot of people have it. A lot of people get treatment for it. And the treatments they use are sort of the opposite of what is actually required. So if you have eczema and you go to the doctor, they give you steroid cream. And it makes it go away temporarily and it comes back. And it's like back, forth. And then you're like, what's going on? Why isn't this getting better? I thought this was supposed to fix it. But you didn't fix the problem. Where's the problem? It's in your gut. So then when you see me for eczema, we change your diet. I don't even do anything with your skin, really. I try to make sure that it stays moist. And curing eczema is an inside-out thing, like a lot of naturopathic things are. So if you Google eczema, it's a skin condition. Very rarely, if never, does it ever say anything to do with your immune system or your diet or sensitivities, anything like that. So now you know something new. You didn't know that before. And that's a nice example of overcoming a bias or an obstacle to your healing by re-educating yourself or better understanding what in fact is actually happening. Let's do another example. How about cholesterol? How about blood pressure? How about anything like that? Usually the solution after a very, very feeble attempt at exercise or weight loss, your doctor will put you on medication. And whether those medications are helpful or harmful or whatever, I mean, it's completely ignoring the mechanisms internally that are happening that will lead to you having high blood pressure and or cholesterol. Similar with diabetes too. Less so with diabetes. Diabetes is a little bit more like, yeah, you do need to lose weight. You do need to exercise. You do need to. There's some understanding of nutrition there, but it's a long ways off. So that's one thing I wanted to mention. I want to talk about what are some obstacles to healing, and of course, when you come to see a naturopath, you realize there's a lot more things in your control that you didn't realize you did have control over. You just didn't think that they were important. A lot of times people will make an effort to do something. They'll adopt, let's say, a modified diet. A lot of people, they'll say, I suspected that I had an issue with dairy. What's going on here? And they'll say, I think I'm a little lactose, which is a misnomer. Anyways, so they'll take dairy out of their diet for like a week, and then they'll bring it back, and they're like, I didn't notice any difference, but my stomach is still bothering me. And then I tried gluten for a week, and I didn't notice a difference. So I'm going to keep having them. I mean, that obviously is a little self-serving, because if you really were suspicious of them, you have to know that it's going to take a little bit more than a week. And you would probably benefit by removing both of them, as opposed to, if they're both a problem, which usually is the case, removing one versus the other, you're not going to get a result. You're not going to get a change, because one of the problems is still there. So that's another little obstacle to cure, is an incomplete attempt. You'll try something, and sometimes it's an earnest attempt. It's honest. It's you thought you were doing the right thing, and maybe you did notice some improvement, but it's too short-lived, and it's not completely addressing the concern. Another example is when someone's trying to lose weight. This is a great example of just the education of an individual failing their attempt to be healthier. So many people, they'll be like, listen, I've really cut down on my eating, and I'm not losing a pound. If anything, I gained some weight. So there's a few things in that. One, people don't understand that. They don't get how eating less causes them to weigh more, because that's mind-boggling to them. And initially it is mind-boggling because it's somewhat counterintuitive. But then when you start to learn that you have a metabolic rate that requires a minimum intake so that your machinery works, and that you actually burn calories, and that you actually utilize the food material, proteins and fats appropriately. So as soon as I tell someone you need to eat more and you want to lose weight, it's met with skepticism, of course. But then in the bigger picture, you zoom out, you realize, oh, I was grossly under eating at times of the day. I was grossly under eating protein and fats. I was over consuming in one meal carbs at the end of the day. And now with all that in context, now you get, oh, of course I'm going to gain weight now that you put it like that. So that's partly the obstacle of bias, and partly the obstacle of an incomplete attempt at correcting the behaviors that are leading to illness in the first place. They're somewhat related. Another obstacle, which I think helps when you talk to a practitioner and you understand what you actually want to work on. And half the time a new patient comes in, what their main concern is, it really shouldn't be their main concern. Meaning, if someone came in and let's say they had a little bit of eczema on their cheek, all right, so I mean, I would want to fix that too. And then we start doing their intake and history, and you realize they've got like sensitivities and gut health issues, and their stress response is bottomed out, and their immune system is really, really doing a number on their overall body, you realize eczema is nothing. That's a visual, superficial symptom, a little yellow flag that gets the patient's attention, which is okay, but that's just the tip of the iceberg, as they say. And so when they realize that they have this, little symptom, they come in, they're like, well, what can you do for this? And I'm like, well, let's fix all the layers underneath, because then that will just like disappear. You won't even be like, oh, I forgot about that. And a lot of people are like, well, if those other things were an issue, those other symptoms, the gut, and the immune system and all that, the inflammation, if that was really a problem, wouldn't that be the thing that they came in for? And initially it's no, because the body tries its best to compensate for these inadequacies. But over time, little cracks in the armor start to show up. So in eczema, again, using that example a lot, that's what gets people's attention. It's nothing to do with their big bloated stomach that they just think is I just need to lose a little weight. It's like, no, you're inflamed. You're bloated. You're fermenting. And then that little patch is just what caught your attention. That's okay. But then this is part of the education process, and allowing people to realize why you come see a naturopath is not necessarily what brought you in the door in the first place. And it's not a trap. I got better things to do than trap people. So like, they'll say, I've heard a lot of this often, and people will say, well, I went in for one thing and all of a sudden he came up with this long list of things I got to fix. I'm like, well, yeah, you got to fix them. If you want to feel better. Some people are resigned. Yeah, that's another one. Maybe that's the fourth thing. People become resigned in their health. The worst example is someone in their early 30s came in, they had a bunch of issues, and like, I guess I'm getting old. I don't know if they really, really meant what they said, but if you're 30 something and you think your symptoms are because of age, it's not a good answer. You have to take ownership for what you're not doing. And I know life is busy and hectic, and sometimes you just overlook what you need to do for yourself because you put yourself last. I get it. But you really can't just use that as an excuse and say, well, what are you going to do? Well, there's lots you can do. There's nothing even just basic, not even taking supplements, not doing any testing, not even majorly changing your diet. Just make sure you're eating breakfast, lunch, dinner. Don't skip meals. Too many people think, I'm doing intermittent fasting. And it's like, well, you're not. You're just lazy to have breakfast. Well, I'm in a hurry. Wake up earlier. Well, I'm already in a rush out the door. Cook something the night before. Have it ready in the morning. There's always a solution to everything. And if we're end up playing this game where I'll suggest something and then they'll come up with a response, and I'll come up with a response to that because I've heard it 1,000 times. If we're going back and forth, clearly this person doesn't want to do the things necessary to get better. Can't force them. They'll have to want to get better, feel better, because unless you can motivate yourself, I'm not a cheerleader. I retired my pom-poms. So if you want to feel better, stop finding excuses. It's easy. It really is. Feeling better is easier than feeling sick all the time. You just have to prioritize what's important and adopt habits that make sense in your routine. They're not hard. You have to be willing to say, okay, well, I'm not going to have those things anymore, or I'm going to have them once a month. You can't say, I can't live without cream cheese. That's not going to cut it here.